Hi everybody, it's Dr. Tauquir Ahmad, and with me I've got the lovely Betty. And Betty, your concern today was the jowls over here. Yeah? So what we were planning to do was a thread lift to lift the jowls here. We're lifting this way and lifting this way. So it's going to be a lower fist lift, and we're going to pop in some PCL threads to try and achieve that and to try and achieve that there. We will put some in here just to give a bit of a lateral pull this way and this way. Do you have any questions that you want to ask?
Yeah, my question is not the neck, but under here. When here is pulled, is it gonna help here a bit?
So what it is for under this area here, we do have a separate treatment for under the chin and the upper neck.
Okay.
And it's a whole different treatment which involves a whole series of threads.
Oh.
However, when we do lift here, it does have a pulling effect on the upper neck.
Alright.
Yes, definitely. And a lot of people that have this treatment done, I always say to them, if they've got laxity up here, there's no point in having that unless you've had this done. So what we'll do is we'll lift as much up here, and then what I'll do is, because I'm going to put some in at the bottom here, I'll try and put a couple of extra just to give you a bit more of a pull along here as well. Okay, fantastic. So what we are going to do is we've taken a 3D scan. We've seen your picture just now. What we will do is we will take another 3D scan after the procedure, which will show exactly how many millimeters you've lifted. And what the procedure is now going to involve is we're going to clean the face. We're going to put some local anaesthetic in to numb the area. Okay, so the whole area will become numb. So you should feel a bit of pressure but no pain.
Okay.
Once the procedure is completed, you'll then use antibiotics for 3 days. We will see you back in 4 weeks' time for a follow-up because your swelling and everything else will have settled. If we feel at 4 weeks we need to pop in 1 or 2 small just adjusting threads, we can do that to finish it off. Or if you're absolutely happy, that'll be great, and we'll do a fresh scan to see exactly how much you've lifted.
Okay.
Alright,
Alright.
fantastic. Yeah, that's swelling, yeah, I'll talk about that in a second. Okay, so that has completed the procedure, and like I said to you before, because you have a lot of tissue here already, that's going to swell. As we go through it, we puncture it, so that will settle down in the next 5 to 7 days. But do you see the shape of for the swelling, do you see the shape of that and that? Are you happy with that? Do you like that? Yep.
Yeah.
And we're trying to put a couple just to give you a bit of a pull in there as well. We're going to see you back in 4 weeks, and then we'll have a look at it. So if you've got any puckering or any dimpling, that will settle down in 4 weeks. The swelling should settle down in a week's time. We're going to give you a course of antibiotics. Use that for 3 days, and we'll see you back, and let's see where you are with that. Happy?
Yeah.
Thank you.